Good evening, everybody. This is Dr. Rao. I'm coming to you with a tip on wellness every day. This is the day 37, and I'm a physician, had been in practice more than 4 decades, and I'm also a student of ancient wisdom. I practice yoga in all phases of life, and I also read ancient philosophy and bring the some of the tidbits of the wisdom into daily life. Okay, I do help people to conquer burnout and stress reduction for IT people, physicians especially. I help with the burnout, and also train corporate leaders with servant leadership. Okay, I do come here just to share some of these wellness tips because I promote proactive wellness to prevent illnesses or to control illnesses or to really overcome illness as a whole. I think it's old fashioned to just have a preventive workup at annual time or once yearly. It is much more prudent and clever and intelligent to be proactively well. Okay, so I do talk about pillars of wellness, the four pillars: the nutrition, the optimal exercise, and good sleep, and also keeping my mind calm. These are the four things I talk about. Today, the topic I want to address is about breathing. It's a big deal, right? Most of the people really don't know how to breathe and also how to use breath to uh, have balance of your emotions and balance of your thought. You can calm your mind by deeping deep and slow, and you can also control your emotions. You can balance your emotions. That's what I want to focus on. I will tell you some of the benefits of breathing techniques, especially if you do the techniques I'm going to talk about. And after we describe the effective breathing techniques, we will also look at what are the take-home points that you could take home, and you have some tips for integrating breathing techniques into daily life. Then that would be, if you are doing breathing, that's fine. But if you are not and you're just getting used to this will be the place to really understand that. Okay. A lot of people have breathing habits that are good, which is very, very good. But many people may not be paying attention to this simple but effective technique of breathings, right? First of all, if you do the deep breathing and if you slow it down, the breath, along with that, your thought, your mind will slow down too. That's one thing. And you can balance your emotions during stressful moments. Uh, it's incredibly effective for managing stress and enhancing overall well-being. Okay, it's a core component, the breathing, of many mindfulness practices, and it can significantly impact your emotional and physical health by activating the body's natural relaxation response. That is the one people miss. There is a relaxation response that can really happen if you just repeat one word for a while and also deep breath. Okay, so we're going to look a deeper look at the benefits of using breathing techniques and also how to practice them effectively. Okay, first of all, you reduce stress and anxiety by controlling the breathing and decreasing the production of stress hormones, in the body. So you can reduce the feelings of anxiety and also feelings of depression, right? That is the first thing. It reduces stress and anxiety mainly, right? We usually do in the clinic when somebody comes in, if they're panic, they're anxious, then immediately we ask them, breathe into this brown bag and give them a brown bag. And by doing that, they kind of control that anxiety, because when you are breathing rapidly and you are breathing very shallow, you kind of produce a lot of carbon dioxide out of your system, and then it produces what we call hyperventilation syndrome, right? It is feeds on itself. The more carbon dioxide you lose, the more you will be anxious, right? So it's a very simple thing to breathe your own carbon dioxide in the brown bag, and thereby retaining all the carbonic acid, we call it carbon dioxide actually. So you will not let it go, but you will breathe the same carbon dioxide you are losing. So that's very simple. We do that with a lot of people, but then they may have underlying disease and other. It's a first aid measure. Like after that, we look into the cause and we look to help them to calm them down or give them some therapy or medication, whatever, right? And also, a lot of people don't realize if you start to deep breath and slow the breath, it does lower your blood pressure. Okay, that is a regular practice, not just once in a while. If you are regularly practicing deep breathing, and then that really lowers your blood pressure. Okay, that improves your cardiovascular health. Otherwise, you will be really going towards uh, the blood pressure effect on your vessels, and in the long run, a lot of problems with that. Anyway, that's a medical problem, but just remember, you can really have a good blood pressure control by deep breathing. Then obviously your respiratory function will improve, because as you are breathing deep and sitting erect, you kind of lower the diaphragms, go all the way down, opening potential alveolar space where the gas exchange happens. Otherwise, they remain potentially there, but they are collapsed. But once you push them down and you expand the alveolar pressure and then take the deep breath, you have more oxygen going in and more carbon dioxide comes out. Okay, that's a very important thing. Okay, um, then respiratory function improves much more with this simple measure. Okay, of course, there are so many varieties of breathing techniques, which I'm going to show some of them. But then basically, your stress and anxiety go down, your blood pressure will improve, and you improve your gross respiratory function, right? I do teach a variety of things to people with asthma, COPD, heart failure, number of things like that. Okay, and also one other thing is, as you take a you know exam, or you are in front of audience, you want to give a lecture, and you take deep breaths. We teach that to the public speaking skills, where you kind of enhance your concentration by deep breathing. That will be very, very, very good to take deep breaths before you are in a anxiety producing situations like a public speaking, right? So it enhances concentration, so focused breathing, that is going to help you clear the mind. That's what happens. And then improve your concentration and mental clarity. Okay. So there are methods we can teach specifically, but that's a general thing. And then suppose you have a bad mood, and you're upset with something somebody said, or something evoked your mood to be bad. You don't feel good. Then start deep breath, and that will also helps your mood, really boosts your mood from depression to something even, right? And then the most important thing I was talking about here, the balance, that promotes the emotional stability and balance of your emotions. Okay, so uh, it kind of controls your calms your nervous system and bring about emotional balance during any stressful situations. See, that is what I teach in my wellness club in the morning. um, don't be reactive to stuff, but respond to the things, and before that I tell them take deep breaths and then be mindful of that breath. That way, your emotions are also controlled, your thoughts are controlled, and you will be very balanced in that way. Okay, so these are all the things you will get the benefit. You will get benefit from the stress and anxiety. You lower your blood pressure, and you improve your respiratory function grossly, and you will enhance your concentration, and your mood is improved, and you promote emotional stability. All these are advantages of breathing. Now let us see some of the effective breathing techniques. Okay, I'm going to say three or four, maybe five of them. Okay, number one is diaphragmatic breathing. See, if you look at anybody, they are doing shallow breath of thoraco-abdominal. That is kind of only thorax comes up a little bit and goes down, right? But this diaphragmatic breathing, basically, you always either stand tall or sit down with your spine erect, and then you let your breathing go in as though you are breathing from the level of the abdomen, sucking the air through the nose, and it is going down. All the way down where your diaphragms are coming down, and then you are expanding your lungs that way. And then as you breathe like that, your abdomen, as you are breathing in, your abdomen rises. That is elevation of abdominal because the diaphragms are coming down. And as you breathe out, abdomen goes in and presses on the diaphragm, and the air comes out of you. So that's why it's called diaphragmatic breathing, because you are using the diaphragm go and come up as a piston, right? You know the piston, right? That's how it comes. Now, that's one way. The other one is 478. What it is you kind of use this technique involving how many seconds you hold the breath, and how many seconds you breathe in and how many seconds you breathe out. Actually, what happens is you breathe in for 7 seconds, then hold it for 4 seconds, and then let it go and breathe out for 8 seconds. So that's another thing you want to remember. Okay. Then there is a box breathing, we call it. It's a technique. It's also known as a square breathing, right? In this one, you improve inhalation of a count of four, you know, and holding the breath for four, exhaling for four. Instead of 478, you are doing 444. Okay, that is the box breathing we talk about. Okay, and then uh, another important one is alternate nostril breathing. So what do you use? You use your right hand thumb and ring finger, and you close the right nostril with the thumb, and breathe in through the open left nostril. And after you have the complete inhalation, you kind of release the thumb and close the left nostril with your ring finger and breathe out through the right nostril, and that makes one circle. And then you repeat the same thing alternately. There's an alternate nostril because very, very, very common, very easy way to do it, and it opens both nostrils of the same caliber. See, many people don't know that every 45 minutes or so, we have one nostril dominant. So if it is dominant now for on the right, after a while it switches naturally, physiologically, where you have more dominance on the left. That means you can breathe much more easily on that. It switches. You can open both nostrils equally by doing the alternate nostril breathing. One more thing I want you to remember here is as you're breathing, remember progressive relaxation can be happening from all the muscle groups as you focus on that muscle group and any tension that you have. Breathe into the tension and let the progressive relaxation happen. Okay, so these are all the um, different techniques. I just gave you three or four, but in the class I do maybe 10 of them. There are different ones, different varieties, different intensities, different use for different diseases on all that. So I can go all that in there. But if you have doubts, you can always DM me. You know? Now, how can we integrate this breathing exercises into daily life? That's what we're going to look at it. Um, you have to have a regular practice. I would recommend do that first thing after you get up in the morning, and also just before you fall asleep. Yeah, maybe take up with 478 or box breathing or alternate nostril, whatever appeals to you, or simple inhalation out and exhalation, right? Do that in the daily, first thing in the morning. That kind of brings you back to your presence. Cultivate that. That's a very good thing. And at the end of the day, you can get all the tensions, everything out, and then you go to sleep. So two times I recommend, right? It doesn't have to be much, maybe 5 minutes, right? And then uh, there are so many apps that can help you to breathe in and breathe out. There was one uh, breathe to ease, I think. That app I used to use for my patients. I put it on the iPad. There are two pistons. As you breathe in, one piston goes up, and you keep with the piston and you breathe in, and the other piston goes down when you breathe out. Okay, so you can increase the time and the intensity of it, but then you just practice to your own capacity to begin with. Don't do too much one time and then not to do for several days. Do even small amount slowly every day, because it's like a muscle building. You don't carry 25 pounds of dumbbell right away, right? And want to do exercise. You want to start with 5 pounds, maybe 10 pounds, 15 pounds, if you're not used to that, right? Like that, you want to build up the capacity of the breathing by starting slow, but being regular, and then increasing slowly, right? Duration, intensity, and all that. Okay. Now, uh, always combine this with the relaxation techniques. For example, your relaxing methods are maybe you have aromatherapy, maybe you listen to music, okay? Or maybe your gentle stretching that you are doing to enhance the effects of breathing, okay? Or you can do all of that. In the yoga asanas, what I do is, as I assume the yoga posture, that's where I have, okay, let's do 5 breaths and hold it, or maybe go to 10 breaths like that, okay? And then when you really breathe, always be here and now. Be mindful, they call it, but I say be aware. You can focus as you breathe in and breathe out. The air that is coming through your ala nasi, it is going in, touching, and you feel the air touching, and then you feel air touch going down too. You can do that. Okay, so that kind of mindful breathing, of touching that air, feeling that air coming in and out, would be very ideal. You don't need any other tools. You just use your own physiological breathing to really be mindful, right? And another thing is, you can go and educate other people who are not doing the deep breathing and tell them what is important, why it is important, how you can do it regularly in the daily life. What I would do is fix up a time and use some apps if you need, and then breathe deeply and associate with relaxation and mindfulness. Okay, if you can do this and also teach other people, right? These are the daily tips that I would say that you should be doing with this breathing balance. Balance the emotions, balance the thoughts by cultivating. deep diaphragmatic breathing. And I taught my son that whenever he stops in front of the red light, just deliberately take 3 deep breaths. And he was doing that, and that became a habit for him. And he is gaining a lot of benefits. He's a musician, so he does go into his mindfulness, calmness much more easily by cultivating this. He's not going to a particular yoga studio, or he's not doing it anywhere, but wherever he's traveling, he's stopping in front of the red. He was doing that. If he's not, I recommend at least take a minute every hour through the working hours, and then do that 1 minute deep breathing. What it does is it takes you away from the brain fog that you're accumulating and brings you to the present moment. That kind of washes of all the unnecessary thoughts or thoughts going on. If you allow the thoughts to go on continuously, then they'll bring so much of clutter, right? So you want to take a break every hour or at least for 1 minute and take deep breaths. That is my recommendation for everybody. Okay. So we covered the breathing for balance. We talked about what are the benefits, and what are the effective techniques, how to integrate them into daily practice. Okay. So if anybody has any question or comment or tell me about your practice, please come up, and I'll be answering if you are coming up and involve me in the discussion. Otherwise, we'll close the room after a while. Okay? Actually, the breathing itself is a very good practice to cultivate, because you won't be impulsive, you won't be reactive, and you won't be really flippant, right? You are very calm and quiet, and then you learn to be responding to situations, not reacting, right? That's a good thing for practice. Okay. I do this series on the weekdays at this hour, 8 o'clock to maybe 8:30 or beyond 8:45 sometimes. But I also come up on and off with other people's rooms, so just to participate and contribute value if I could. Okay. Otherwise, I do this breathing practice much more vigorously in the morning, half an hour, and in the evening, half an hour. And once you get used to that, once you learn to wash off all your anxiety, stress, like that, it becomes really good habit, and then you don't stay away from that. It doesn't matter what the day is going to bring. You can be balanced and then respond to situations equanimously, right? Equanimous is a good thing in yoga. And another thing yoga teaches you is not to cling to anything. Okay. So if something happens, okay, experience it and let it pass. So do not cling to things. That is yogi, right? And you always live in the present. Okay. Thank you. Thank you for listening to me. And I will see you back again tomorrow with another tip on the wellness. Bye.